Knee arthritis, like other arthritis throughout your body, is basically where you have lost the normal smooth cartilage on the end of our bone. All of our bones have a nice smooth cartilage that allows for a smooth movement of your joint as you walk or move that joint. With arthritis, you lose that normal cartilage, so instead you have roughened surfaces that can cause pain, they can cause swelling, they can cause a limitation in your motion. Non-surgical options that you have prior to undergoing a replacement include medications such as Tylenol or anti-inflammatories like ibuprofen. We also have options of injections. There are cortisone injections, there are gel or synthetic injections, and there are also other injections that you may have heard of such as PRP or stem cell injections. Knee replacement is simply a resurfacing of the end of your bone in your knee joint. So your knee joint includes the femur as well as the tibia. So a knee replacement is simply when we go in through an incision directly down the center of your knee. We cut off the bad cartilage on the end of your bone and we cement a metal cap that fits your size on the end of the bone. On the top of your leg bone, we make a flat cut as well, and we cement a metal tray and a plastic piece that locks in between. Your kneecap itself stays on there, just the undersurface we shave off and we put a plastic button. So when you're walking and when you're bending your knee, it's metal on plastic parts. That's where you get your pain relief from because there's no nerve endings within that knee replacement. There have been many advances in what we call the perioperative pain control around the surgery time period. Prior to any surgery, you will talk with the anesthesiologist. Typically we're using a spinal anesthesia, which is kind of like an epidural, when they numb your legs from the waist down. You're still put asleep from the surgery, but you don't have to be intubated or tubed. This allows you to wake up quicker. It also decreases your pain after the surgery. There are certain medications that the anesthesiologist will give you during the surgery to decrease pain as well. While you're still asleep, but after the new replacement parts are in, I use a local anesthetic that I inject into the tissue around either the hip or the knee that really helps to take away the majority of your pain for the first 36 hours. This allows you to get up on the same day of surgery, walk with a therapist, and get home and get through that first night into the next day. Going home after the surgery, we send you home with an ice pack machine, we send you home with anti-inflammatories if you're allowed to take those, and also a pain pill or a narcotic pain pill if you need it during your recovery time period. I encourage all of my patients to go home the same day of surgery. Because of the advancements that we've made in the anesthesia and the pain control around the surgery time period, patients are actually more comfortable going home the same day because the nerve blocks and the medications are really working well. We get you up walking on the same day of surgery with a physical therapist so they can go over different tips and tricks to help you get around the house. And patients have very much enjoyed going home the same day to get home to your own bed, your own food, and have your family support as well. As an orthopedic surgeon specializing in joint replacement, I do both non-robotic knee replacement as well as robotic-assisted knee replacement. Either way, however that is done, patients do well and they regain their quality of life. There have been some misconceptions about what robotic-assisted surgery is. It is not a robot that stands in the room and does the surgery for you. The surgeon is very much guiding that robot as it does that. The specific robotic-assisted system that I use, the robot helps me to position the cutting blocks to make the different bone cuts that are needed for a knee replacement, but I am still the one actually doing all of the cuts. There have been some studies looking at the advantages of robotic assistance. These studies have shown that sometimes there is a decrease in blood loss as well as decrease in discomfort around the surgery site due to the assistance of that robotic arm. Overall, I do think there is an advantage to robotic-assisted surgery, and that is part of the discussion that we will have when we go over our surgical plan. Hip or knee replacements typically nowadays should last you hopefully 20 to 30 years. In the past, sometimes they would last anywhere between 5 to 10, but now with the new technology, specifically with the polyethylene or the plastic piece that goes in those hip and knee replacements, these should last you now hopefully 20 to 30 years and maybe even longer.